Hello, this is Dr. Grande. Today's question is, what causes avoidant personality disorder? So in the world of mental health disorder research, when we talk about the term causation, we use the word etiology. So if a factor is etiological to a mental health disorder, it's causal. And a lot of times when we talk about causative factors, when we talk about etiology, we're really talking about associations between factors, as opposed to knowing for certain that some particular factor causes a mental health disorder. So we use the word cause in etiology, but a lot of times we really mean an association. Now, if we see enough of the same association, sometimes that's where we think, well, this is probably causal. There seems to be some sort of causal component to it, or we would not have seen all these different associations. But still, it's important to be aware that association is not the same thing as causation. Now, when it comes specifically to avoidant personality disorder and its etiology, there have been a number of studies. One of them in 2015 really looked at neglect as a possible etiological factor. However, with a number of these studies, it's important to understand there are some methodology problems. Avoidant personality disorder is somewhat similar to social anxiety disorder. And the two disorders are also comorbid, meaning they tend to co-occur in individuals quite a bit. So if someone has avoidant personality disorder, it's more likely they have social anxiety disorder, and the opposite is true. So when researchers look for samples of individuals who only have avoidant personality disorder, it's difficult to find people in that category. A number of times, an individual with avoidant personality disorder would also have social anxiety disorder. So trying to differentiate between the two and what causes each of them can be difficult. To add to the confusion, social anxiety disorder is also referred to as social phobia. Those two constructs are the same thing. So we have avoidant personality disorder, social anxiety disorder, and social phobia all mixed in a lot of this research. So when it comes to what we know about the etiological factors for avoidant personality disorder, heritability accounts for about 50% of the variance in the symptom levels in avoidant personality disorder, meaning we believe genetics explain about half of the reason why somebody develops avoidant personality disorder. The other half we call environmentability, meaning it's caused by the environment, by stressors. And that's really where a lot of this research has been focused, on what environmental factors could be leading to avoidant personality disorder. When we talk about avoidant personality disorder and social anxiety disorder, we see they have the same genetic factors. The heritability factors seem similar, but the environmental factors seem a little bit different. A lot of attention has been given to the constructs of physical abuse, neglect, and emotional abuse as etiological for personality disorders, and specifically for avoidant personality disorder. Physical abuse has been studied a lot more than neglect and emotional abuse. There is strong evidence, however, that neglect and emotional abuse could be tied with avoidant personality disorder. We know that trauma in general, including all those forms of abuse, has been linked in general to personality disorders, to the development of personality disorders. Abuse and neglect make someone 4 times more likely to develop a personality disorder. Now, specifically with avoidant personality disorder, we see a few factors. An increase in neglect seems to be associated with the development of avoidant personality disorder. A lower amount of the expression of parental love and pride are associated with the disorder. An increased amount of intolerance by parents, also trying to shame a child and to cause guilt. All those are associated with the development of avoidant personality disorder, and to a lesser extent, the development of social anxiety disorder. One of the factors that makes this difficult to figure out in terms of neglect versus emotional abuse and physical abuse is that physical abuse, neglect, and emotional abuse often co-occur. So just like it's difficult to find individuals who only have avoidant personality disorder and don't also have social anxiety disorder, it's difficult to find individuals who have suffered from neglect and emotional abuse but weren't physically abused. So there are a number of confounding factors in studies like this. Another element that may be causal for avoidant personality disorder and for social anxiety disorder is a trait called behavioral inhibition. And this would be where somebody is shy, avoids new experiences, avoids strangers, and has increased sensitivity and anxiety reaction. Behavioral inhibition, this temperamental factor, is largely thought of as genetic. So this would be part of the 50% heritability piece I talked about earlier, as opposed to the 50% environmentability. So what's the mechanism for this causation? Well, there are a number of theories about why neglect and abuse and behavioral inhibition appear to be tied to the development of avoidant personality disorder. One is that the neglect and the emotional abuse cause feelings of worthlessness. A person can feel that they're not worthy of being loved because of the way they were treated, and they don't see others as safe or supportive as they grow up. So they tend to develop feelings of mistrust. This mistrust, this lower level of trust, can be viewed as arrogant, and it can make other people not want to interact with that individual. And this leads to increased isolation. The increased isolation leads back to a lower level of trust. So there's a cycle that gets started with the abuse and the neglect and carries on into adolescence and adulthood, and we look at this as avoidant personality disorder. Now again, this is just one theory of the etiology of avoidant personality disorder. One of the things we can learn from these factors being linked with avoidant personality disorder is that all abuse is destructive. Physical abuse, physical neglect, emotional abuse, all these factors have consequences, have negative consequences for mental health. And we need to work hard to prevent abuse of any type from occurring. I hope you found this description of the etiology of avoidant personality disorder to be interesting. Thanks for watching.